One of the things that patients of mine often worry about in the first days and weeks after a baby is born is why their baby's skin looks a little bit yellow. So I just wanted to explain a little bit about why that happens and the process and when we worry and when we don't worry. So it's totally normal for newborns to have elevated bilirubin levels. So bilirubin is the chemical in the blood that gets elevated. And when that happens, we see a yellowish discoloration of the skin, which is called jaundice. When we see a yellowish discoloration in the eye, that's called icterus. So most babies have some amount of this. It may or may not be enough to really see it at all, but most have some amount of this. And the reason for that is because the liver in a newborn is not very well able yet to metabolize the bilirubin. And there are a number of things that can happen also during that newborn period that can cause there to be more bilirubin. So there's a little more bilirubin, and then it's harder for the body to process that bilirubin, and that leads to jaundice. So we expect it to happen in some amount. And we look at the numbers, and I don't want to get too into numbers, but there's kind of a point at which we start to see it physically, and usually we'll see it first in the eyes before we see it anywhere else. Then it kind of starts to spread into the face and then into the trunk or like chest, upper body, and then kind of out the arms and down the legs. So it's at around the level 5 that you start to typically see it in the eyes. Now, the reason we worry about it is because if the bilirubin gets too high, then it can get to the point where it can affect the brain and cause some developmental problems. So it can be quite serious if we get too high. And the numbers at which we worry are different depending on how old a baby is, by hours and days of life. So a bilirubin of 5 at 3 days old would not really worry me, but a bilirubin of 5 in a 12-hour-old would worry me. So we kind of know what we're looking for in those first hours and in the hospital, and we're actually keeping a track of that. And it's routine to check a bilirubin level in some way at 24 hours of life, and many places repeat it again before discharge no matter what. Some repeat it again just based on what that first level is. There are guidelines for us to look at that tell us if the bilirubin is at this level, at this hour, that's safe, very unlikely to get high quickly enough to be a problem, or that's kind of high, probably we should recheck it at some point, or that's really high, we're getting close to a dangerous level, we need to actually treat it. And the treatment is phototherapy, which you may have heard of, or if it gets really, really high, this is a point where a baby would be transferred to the ICU, and we actually take out some blood and put in some fresh blood that has that lower level of bilirubin. So we're kind of washing out that bilirubin so that it doesn't get into the brain and cause problems. That's not very common, but phototherapy is not too uncommon. So what happens is that if we see jaundice, if we see any visible feeling that a baby is looking yellow in those first 24 hours of life, that could be a problem. So we always will check that. Then we do the routine checks that I just talked about. And if everything looks safe and the baby's otherwise doing well, that baby will get discharged home. And then one of the reasons why we see babies so quickly after they go home is again to monitor that jaundice and see how it looks and whether we need to check it again. Now, we used to not check the actual blood levels, or now we can check using something called a transcutaneous bilirubinometer that just kind of figures out what the bilirubin is just by kind of a sensor on the skin. So it's not invasive. It's not as perfect as the blood level, but it can give us an indication of what's going on. We used to really just look at babies and be like, okay, I think it's high or I think it's low. We should check it or we shouldn't check it. And we realized over time that that was not a very reliable way to make a decision about whether to check it. We have very little to lose by doing that check, and a lot to lose by not doing the check and missing serious jaundice. Hopefully that makes sense. So when a baby goes home and then comes to see the doctor for that first visit, the doctor doesn't always have like that transcutaneous bilirubinometer. Some have them in their offices and some don't. If they don't, then they kind of have to go back to that, looking at the baby and seeing what their color looks like and deciding whether or not to check it again. And they also are able to use the information from their first bilirubin levels. So if those first bilirubin levels were pretty low and not going up too fast and the baby doesn't look that yellow, then you can be reassured. But in a baby where it was maybe already kind of borderline and they're looking fairly yellow, then you may go ahead and check it. Or you may have them come back very soon, like the very next day, to check the baby again. So what you should know is a few things. So bilirubin, it happens to everyone, but some higher than others, can be dangerous. That's why we test for it and check for it. But there's a few things that can put your baby at risk for having higher bilirubin or having more problems from higher bilirubin levels. So being premature can be a risk. Being sick for some other reason, like let's say we think your baby has an infection, that puts them at higher risk for having a bilirubin problem. Also, sometimes babies have big bruises on their head from the birth process and kind of rubbing against the birth canal and the bones of the pelvis. They come out with these big bruises. As those bruises resolve, more bilirubin gets put into the bloodstream, and that can increase the levels too. Babies that are not feeding well may have more problems too, and that can be an indication of high bilirubin levels because babies can get kind of sleepy from that too. So sometimes it's hard to know what came first, the chicken or the egg. But we put all of those things together and also look at when the higher bilirubin is happening. So in those first few days of life, when babies go high, especially like breastfeeding babies who are going higher in those first days of life with the bilirubin, that we call breastfeeding jaundice. And the reason we call it breastfeeding jaundice, I don't really love this term because it's not so much from the breastfeeding, but it's a little more likely to happen with breastfeeding babies than bottle-fed babies because the volumes that babies are getting are lower and sometimes lower than necessary, and we don't really know that quite yet because all of the other indicators look like babies eating, babies peeing, babies pooping, but yet they're not getting quite enough food and they're getting a little bit dehydrated, and that can lead to that bilirubin being a little bit higher. So that's, again, a reason that we do very, very close follow-up in those first few days to make sure that that's not happening, and if it is, to start to supplement or do whatever we need to do to get that baby not hydrated and get the bilirubin level down. Another thing is that babies poop out the jaundice. That's the main way that they get rid of it. So babies that are not pooping very much for whatever reason, usually related to not eating that much, also, it's going to take longer for them to get rid of the jaundice. So that's something to be aware of. Now, there's also something that we see with breastfed babies called breast milk jaundice. And this is jaundice that either pops up a little bit later or it is noted that the jaundice just doesn't go down the way we would expect. So the typical thing that we'll see is the jaundice level going up gradually until somewhere between day 3 and 5 of life, and then the jaundice level plateaus, and then it starts to come down gradually. And in most babies, by a week, unless it did get to a pretty high level, in most babies, you really can't see much, if any, jaundice or icterus by a week old. But sometimes in breastfed babies, it seems to linger, or they didn't seem that jaundiced, and suddenly they're seeming a little more jaundiced later than you would expect. And that can be something wrong, but it also can be what we call breast milk jaundice. There's something in breast milk that makes it just take longer for breastfed babies to get rid of the jaundice. And this this type of jaundice, typically, unless it is put together, unless it's combined with some other problem leading to elevated jaundice, it's usually not high enough to cause any sort of real problem or needing phototherapy in and of itself. And it decreases just little by little over time. And really, typically, there's nothing that you need to do for it besides wait. But it can take a month or even two to go away. And so sometimes we as pediatricians, if it's not going away as expected, we may check another level at some point to make sure that it looks like that's what's going on and that there's not something else going on with your liver or your blood that is causing an elevated level. So I probably put too many details in here, but I just wanted you to kind of understand the gist of what's going on, that there's a timeline, and we may need to check your jaundice level a few times over that first week to be reassured, but it is really an important thing to monitor. And usually at home, the things that you would be looking for, if your baby goes home at day 3, let's say, of life, they may get a little bit more jaundiced before it starts to get better. And that wouldn't be worrisome unless you feel like suddenly they are like orange and glowing. Then they probably need to be seen pretty soon and maybe not waiting until your next doctor's visit, depending on when it's going to be. So at least a call into your doctor. If you think your baby's really getting significantly more yellow and they're getting more pokey, they seem more sleepy, it's harder to feed them, they're not having as many wet diapers or poopy diapers, so there's other things going on that make you a little bit worried about your baby, it's never wrong to have your baby checked, okay? So that's a really, really important thing. I think sometimes people don't want to overreact, don't want to bother their doctor. Bother away. It's really hard sometimes, even for doctors, to know what's going on with babies when they're so young because they just can't tell us. There's not enough clues sometimes. And so if you're worried, reach out to us. We don't want to miss anything either. And we would rather get that call in the middle of the night or have you come in for an extra random visit during that first week to be able to reassure us all than to miss something. I think pretty much all pediatricians or family medicine docs, anybody who takes care of newborns would feel the same way. So a little bit about jaundice and my favorite chemical in the body, bilirubin. You can probably figure out why, and hopefully this is helpful. If you have any questions, throw them in the chat or email me and I can give you some answers. Talk to you later. Have a great day. Bye-bye.